Major funding for these broadcasts is made possible by grants from Capital One Bank, New York Community Bank, Eastern Consolidated, M&T Bank, Sterling National Bank, Meridian Capital Group, Customers Bank, Ariel Property Advisors, Dime Community Bank. Additional funding is made possible by grants from AM Trust Title, AVR Realty Company, Avison Young, Bank of America Merrill Lynch, Bank Leumi USA, Briarwood Organization, CBRE, Chase Commercial Term Lending, Chase Commercial Mortgage, Citizens Bank, CPEX Real Estate Services, Colliers International NYC, Cohen Equities, Collins Building Services, Douglaston Development, Levine Builders, Flushing Bank, Friedman LLP, Handler Real Estate Organization, Handro Properties, Hodges Ward Elliott Inc., Investors Bank, James D. Kuhn Real Estate Institute at Syracuse University, Kilroy Architectural Windows, Madison Realty Capital, Matone Group, Mercantile Bank, New Banks, Newmark Knight Frank, Optimum Window Manufacturing Corp., People's United Bank, Rockefeller Group, Rosewood Realty Group, SJP Properties, Stonehenge Partners, TD Bank, Terra CRG, the Meringoff Family Foundation, the Moynihan Organization, Moynihan Capital Partners, and these friends.
Healthcare 2018. Where are we? We're in a different time today. You see ambulatory centers, you see surgery centers, you see mergers, you see changes taking place. So what's happening? What's really happening? Today I've assembled this group of healthcare leaders to provide their insight on Healthcare 2018. My guests include Dr. Andy Brotman, who is the Vice Dean and Senior Vice President for Clinical Affairs at the NYU Langone Health. Andy Rubin, who is the Vice President for Clinical Affairs at NYU Langone Health. And last but not least, Dr. Bret, Rudy, who is the Executive Director and Senior Vice President, NYU Langone, Brooklyn. So when you started in healthcare, different world today, right?
Completely different world. I had the unusual opportunity to come to New York after 20 years in Boston in 1999 and start ambulatory care at NYU from scratch. Andrew joined me 1 year later, and now we have 230 sites.
So what did you have in 1999?
We had all private practice doctors who did what they did. They had their own businesses, and there really wasn't much programmatic opportunity, and there was very little outreach to the community.
When you started in practice, what was it like then?
Really, I think that there was far less focus on ambulatory care. The hospital was really the centerpiece of care for, and that's a pediatrician by training, so was at the Children's Hospital of Philadelphia. And that was really the cornerstone. And very early on, there was a realization by the hospital that we really needed to expand into the community, really affiliate with practices, and really try to coordinate healthcare across the kind of continuum of care for kids.
So how have we done over an 18-year period this change from individuals practicing on their own, becoming employees of a place, now in many instances saying that they must abide by the rules, they have to take the insurance, they've done this. How have we been able to adapt, and specifically NYU Langone, who literally was just a freestanding institution without many affiliations. You know, they had the Hospital for Joint Disease, but it was a different affiliation. Where are we today? As you were saying, 220 practices?
Yeah, so, you know, Andy told me a story when he hired me 18 years ago that NYU had not added a cardiologist to its faculty. It was 9 years when we had started together. Now we add, you know, probably 10 to 15 a year. So we've come a long way. 230 practices, 260 sites in the region, all in New York. So Long Island, Brooklyn, Queens, Staten Island.
Wait a second, you opened up in Florida recently.
We opened up in
Florida. You know, you're in
Florida.
Delray and you're in West Palm Beach.
Yes, we have 5,000 patients who get there, who with a primary address in Palm Beach County, who visit us for health care annually. So we thought it'd be nice to be able to see them locally, as ambulatory care is, locally in the community where they're living, and equally as important, connect them to our electronic record, which all of our doctors in the health system are now connected to, which allows us to see their entire medical record regardless of where they're visiting us in our health system.
I mean, in 1999, if I remember well, NYU had a cancer center, but it was not it was within a building, okay?
Yes.
It was on the campus. Now we're talking about properties which are freestanding.
Yes.
Like the Perlmutter, which is on 34th Street, and
Yes.
then the new Perlmutter that's going to be in Brooklyn with you over there. It's a different case. Let's talk about Brooklyn.
Sure.
You know, NYU made a major commitment a couple of years taking over the Lutheran Medical Center. It's a different facility, it's a different operation. So talk to me about what's happening there, the plan changes, and the other things taking place in Brooklyn.
When you looked at our patients that were getting care in Manhattan, about 30% were going back to Brooklyn. And if you look at mothers that were delivering at NYU, about 50% were going back to Brooklyn. You know, Andy and Andrew really were already building a very large ambulatory network. So for those patients who do need hospital-level care, we really wanted to be able to provide as much of that in the community as we could. So we've really gone in and really focused on providing the services that were lacking there in terms of really great subspecialty care, but have really focused a lot on the quality of care and efficiency of care that we provide in Brooklyn, as well as doing a campus transformation to bring the facilities eventually up to the standard of care that we think that all Brooklynites deserve.
Let's talk about the family health centers, which not that many people are aware of. What you do for the community with the family health centers.
Yeah, I'll take that because the family health centers were part of what was attractive about having an affiliation with Lutheran. There's a program that the federal government runs to help support primary care in underserved communities, and the family health centers do that. We have 9 of them, soon to open a 10th. We do 630,000 visits for children and adults in those centers spread around Brooklyn. A lot of school-based programs in homeless shelters, and basically it's an opportunity for people to get primary care and then get their secondary care and hospital care through the system.
Now
So
they're covered by Medicare, Medicaid?
mostly Medicaid. There's a significant number who are self-pay, but it's mostly a Medicaid population. And Brooklyn is mostly a Medicaid borough. The amount of Medicaid in Brooklyn is extraordinary, and the amount of Medicaid in the zip code of Sunset Park is the highest percentage in the United States.
Let's talk about the other new ambulatory facilities opening up in Brooklyn and in Manhattan,
Yeah, I
Lower
mean,
East Side, and
Nearby, on 41st Street, we're opening a 275,000 square foot ambulatory center on 41st Street.
now for my audience, can we explain what an ambulatory care center is?
It's basic.
I mean, because there are different words to different people.
Basically, an ambulatory center, you don't stay overnight. There are no beds. You receive office-based care or maybe even procedural care, but then you go home. So you can get a colonoscopy in such a center. You can have cataract surgery in such a center, but you can't have a multi-day stay. So our model that we like the best is a multi-specialty group practice where you can get 95, 97% of what you need in that practice. And then if you have something far more serious, you go to the hospital, but it's less and less and less.
Now, what about the emergency rooms? What's being used today with regard to the emergency rooms? I think one of the great things about the NYU Langone Health is that you've really been able to see a patient. I think I met with your people last week as quick as 13 minutes in Brooklyn.
Correct.
And I think the same number in Manhattan over there. I mean, years ago, you go to an emergency room, you just sit there waiting for the gurney to take care of it.
Well, emergency rooms are still tough places, and they're still frequently overcrowded. We've tried to streamline things so that people don't wait in the waiting room, but to be fair, sometimes they wait once they're inside.
But if they're seen initially for an observation, it
Yes.
helps.
Yes.
And, depending on
We
the
try to
side
get
effect.
to every patient within 15 minutes of them walking in the office. But people who come to the emergency room, what we're trying to do with all this ambulatory care is make sure that people who come to the emergency room with something minor don't do that, and they go to ambulatory care, and that it's only people who have truly urgent problems who come to the ED.
Even though you don't have freestanding urgent care centers, which I'd like an explanation of what you perceive an urgent care center, you are planning to open up urgent care within
Yes.
some of your ambulatory care.
Yes.
Urgent care centers are inherently expensive. You need to see a certain number of patients per day. They tend to be in retail locations, which is expensive real estate. And as everybody who's living in the region knows, there are urgent care centers on every few blocks. That strategy for healthcare remains to be seen whether it will be successful long term. It certainly helps get people seen quickly if they are not needed to be seen in an emergency room. We have a slightly different take on urgent care. We think it plays an important role, but in order to manage the cost and still provide the service to the patient, we think it's best housed within our existing ambulatory care centers. So to a patient who's walking by on the street, it'll still feel and is in an urgent care center. They'll be seen by urgent care doctors. It may be in the same building that their regular primary care physician is in, but they don't need to make an appointment. They can walk in and be seen.
Will this be like the other urgent care centers throughout the city and the region, signs that this is NYU Langone Health urgent care?
People will know that they're going into an urgent care center. It may be housed within a physician office, but it's going to be separate, distinct space. And the advertising, if you will, the street signage will be next to a sign that
where are
says
these
a physician
centers going
office.
to be located physically?
We actually opened our first one last month on West 52nd Street. We do have one independent freestanding urgent care center downtown by the Freedom Tower.
The Trinity Place?
Near Trinity Place. And then we plan to open 2 or 3 more, one in Queens in Rego Park, and then in Huntington within the next 6 to 8 months.
What we're strategizing about in terms of urgent care is it seems to us that urgent care is attractive because it's convenient. And if there's something else that can be convenient, we think that will be attractive too. So we're making a big push to virtual urgent care, which is telemedicine, where you can go online and you can either book an appointment for later in the day with a doctor or book it urgently and have it over the phone. 85% of the people who go into urgent care centers don't need a blood test or a picture or anything like that. So, we can handle 85% telemedically, and then we refer people to our own sites for the rest.
How are the patients accepting the telemedicine?
So it's a work in progress. The younger people are more accepting than the older people. As a matter of fact, increasingly, young people are not getting primary care doctors. Mm-hmm. They are using these various convenient things and waiting until later to get them. Older people, a little bit less acceptance, but as the technology gets better and more user-friendly and more convenient, I think it will catch on.
With regard to that, don't you have a program with a stroke program with the urgent?
We do. Actually, not with urgent cares, but with some other facilities. So at both campuses, we're comprehensive stroke centers. And so we provide telestroke for some locations to determine what's going, to look at a patient and determine whether the patient requires an intervention. And then if the patient requires an intervention, we have the patient transported in and goes right into the lab to get the intervention done.
How do you get that message across to the consumer that you have this program? I mean, because
yeah, it's not that easy. We're going to use our medical record, which has actually 3 million patients in that medical record, and we're going to broadcast it through that vehicle as opposed to standard marketing or advertising.
let's talk about the expansion around the city. What you're planning to do in Brooklyn first, and then talk about other aspects.
So, we've focused a lot right now on bringing talented physicians into the system that provide services that we did not provide. For example, gynecologic oncology, oncologic surgeons, advanced endoscopy. These were programs that patients most commonly needed to go back into the city for, into Manhattan. So we're providing that locally. So we've really been building the expertise in the facility. We're also doing renovations within the facility before we build a new hospital tower to be able to accommodate those patients and to be able to really accommodate the technology to do that. So that is our focus right now. And also, as Andy pointed out, when we went into this affiliation and then the merger, the most important thing was to get everyone on the same electronic health record, meaning that now every patient that touches the system in Brooklyn is in the same medical record. So if we have a patient who hits one of the homeless health clinics, sees a physician, and that physician, they tell that physician, I was in the emergency room at NYU Langone Hospital, Brooklyn, they can see exactly what happened at that visit. Medications, and there's also the ability for patients to go on what's called MyChart, where they can communicate with their physicians, ask for medication refills, etc. And it makes it much more convenient, and as this is a vehicle for patients to actually expand access for patients.
Let's talk a little bit about the former Long Island College Hospital location, Brighton Beach. We were talking about Bay Ridge and so on, about that.
So we had, prior to the merger, had already started expanding throughout Brooklyn, primarily along the coast, so from Bay Ridge down to Midwood, down to Brighton Beach and Coney Island. We, as Andy I'm sure will talk about, with the taking over of the healthcare services that were provided at the former Litch Hospital, we have big plans for an ambulatory care building in addition to the emergency room that's operating now. And we currently have 10 physicians. We opened up about 2 months ago in one of the old Litch buildings that's not being torn down to make room for the new condominiums, where we are seeing patients from Park Slope all the way around there, and they're getting their health care in Sunset Park.
You have a 24-hour emergency room on the campus.
24-hour emergency room, and then some primary care and specialty care now being provided right in that community where that hospital used to sit.
And you were talking about Bay Ridge on 65th Street?
We have, there was an existing ambulatory location on 5th Avenue and 65th Street where we have about 15 to 20 physicians. We are going to be redeveloping that site, and we are midway through redeveloping, and some services are now open in a new building on 4th Avenue closer to the Gowanus, where we have about 60 to 70,000 square feet in a new state-of-the-art building. So basically consolidating all of our physicians. Bay Ridge, that area tended to have a lot of smaller, what I would call mom and pop physician offices. The healthcare, while excellent doctors, in many cases somewhat fragmented. So having them in one location on one electronic record, being able to refer within the building and then ultimately into the hospital has been very effective clinically and economically in terms of keeping costs down.
Now, I think I read that you opened up something in Greenpoint recently.
We did.
We did.
What is that?
So that's a multi-specialty site. It was affiliated with another hospital. That affiliation changed. As we do with most sites, we immediately started planning on adding other services and are signing a lease on an additional 20,000 square feet around the block to grow that site. So that's a multi-specialty care site. We're going to have imaging and a new imaging center in the building right there, and it's been pretty successful so far, and it's only been about 6 months.
You know, we were talking before in the green room about real estate, and the number of square feet being added is mind-boggling, mostly in the ambulatory sector. And this is both consolidation and expansion. And what's happened is the regulatory environment has become more and more difficult for small doctor practices can manage, between the electronic medical record and having to deal with the insurance company for prior approval, and all the insurers requiring electronic billing and et cetera, et cetera. It's become very difficult, so people have aligned with organizations like ours who take care of all those things and leave.
I don't want to age you or I, but since we both got involved in healthcare similar, I may have been involved before by teaching at both medical and dental schools. I used to teach a course teaching a physician or a dentist to go into a practice.
Yes.
Today, that course is not needed.
That's right.
Because I think the course is to learn how to negotiate a contract with a health center.
The course is needed, but the course is needed for a different audience.
Correct.
You know, healthcare administrators, until fairly recently, typically went on an educational track that was more aligned with traditional hospital care.
Right, the MPH.
So finding future healthcare leaders, both doctors and not doctors, who are interested in administration, but orienting them towards what ambulatory care, healthcare is all about, is just beginning. And I can tell you that it's an excellent career choice, because there's just, as we continue to grow and grow and grow, we add jobs on top of jobs on top of jobs, and there just aren't enough qualified people to fill them.
What you said about teaching, same thing happened to me. The course that used to be well liked was how do you start a practice. Now it's the economics of healthcare, and my most popular talk is how to review and analyze a contract.
I agree. Before it was how to negotiate a lease.
Yes.
Today you don't need to negotiate the lease. It's tell me the contract
Exactly.
over there. The city is gentrified, okay? Anything that, as I say on many of my shows, anything that's near a transit-oriented development is doing well. Trains are very important, and the growth. We're talking before about Long Island City.
Yes.
And we're talking about additional locations, you know, in other areas, and you know, the relationship with Winthrop, which I'd like you to explain also.
Yes. So we are opening a ambulatory care center in Long Island City. We're opening one downtown in what they call Essex Crossing, which is on Delancey Street.
Which is 9 square blocks.
Which is a huge development. Obviously, Nassau and Suffolk County will be a focus of ambulatory expansion with our affiliation with Winthrop. We were heavily focused in Nassau even before that. That will expand. And while there are a lot of gentrifying neighborhoods, there is also an enormous Medicaid and underinsured population that you really can't be a big system without serving. So it's...
But that's being served specifically by, in one case, by the family health centers.
Family health centers are certainly an integral part of that, you know, and we all, you know, that they provide superb primary care. In the school-based health clinics, they provide a lot of primary care to students in those schools, and you know, that's an important part of the strategy, and obviously the care, but also to make sure that they have access, because access to subspecialty care has been something that has been difficult for some of those patient populations.
So in the same way that a retailer analyzes a neighborhood of where they want to open up a location, how are you, as you say, it's a different world, healthcare today, even the administration job, and the fact that there is a need for future healthcare leaders. How do you make a determination of where you're going to spend a lot of money, like you're doing in Essex Crossing in downtown, what you're doing on the Litch campus over there? How do you make that determination of what's the right place, and you have enough place for future expansion?
Well, there are a lot of factors. You know, probably the one that comes first is where are your patients coming from? right? So if you know that the hospital or the emergency rooms, the referral patterns are coming from certain neighborhoods and you don't have a big presence there, you want to be in that neighborhood to be able to provide the care closer where they live, potentially keeping them out of the emergency room at a later date and avoiding unnecessary surgery. Where are our referring doctors coming from? Our existing referring doctors are facing the same challenges that all independent physicians are facing. So are they interested in aligning with us? And also you want to see what other health systems are in that neighborhood and not necessarily compete too heavily in there if they have a dominant presence.
How do you compete in today's world? I mean, it is competition.
It is competition. You know, our primary strategy is not to plant a flag in a zip code that looks like a good zip code on a map and say we're here. It's to align with indigenous doctors who have a reputational status that's pre-existing and to build around them in order to serve that community better. And to do an awful lot of local advertising. While we have the TV commercials, this and that, most of that, and you know more
And the
about,
buses.
and the buses, most of that, you know better than I, is brand recognition. But the actual sort of more local, here's the service we have here, are in the little local newspapers, the local radio shows, the cable shows, etc. And it's really a neighborhood-based outreach.
People still have the feeling that if the healthcare institution is in Manhattan, it's better than the healthcare institution being in Brooklyn or other places. How do you get the patient to feel comfortable saying you are going to NYU Langone, Brooklyn, or NYU Winthrop, and they say, no, I want to be in Manhattan? How do you do that?
So first of all, we don't force.
No, I agree. I mean, how
and we
do you get the comfort?
We start with the local community. So if somebody in the local community is in that emergency room or seeing that doctor, et cetera, and they need something like a cardiac catheterization or something like that, we will then raise the question, we have a cath lab at NYU Langone, Brooklyn. And it's the same doctors and services that we have in Manhattan. And it might be more convenient for you, particularly since you'll be out in 6 hours.
I mean,
and then
I
it's
agree.
word of mouth.
Specifically in that area, what you're doing right now with the new Perlmutter Cancer Center at NYU Brooklyn, Langone, Brooklyn, it's right there. I mean, it's easier for the patients in that community to have the same quality of care and all the services being in their neighborhood as opposed to going to 34th Street and 3rd Avenue.
And there are some differences. I mean, you can't get a transplant everywhere. You can't have a bone marrow transplant. You can't get, very complex neurosurgery. So neonates. There are things that you should come to a tertiary or quaternary hospital. But we're trying to make all those things that are safely and capably done locally done with excellence.
So, as you said before, in 1999, the pendulum was private practice, 98%. Okay. Today, it's a different world, like 65%. Okay. Yes. The ambulatory is different, and if we came back a year from now, I guarantee you it'll be different. But one thing I'm certain is that the NYU Langone Health system will only grow and do well, and I'd like to thank Andy, Andrew, and Bret, and I'll see you next week.